Disability shouldn't be seen as a bad thing. I think it's important that we recognise that each of our clients need to be assessed on their individual situation and circumstance, and in doing that, you can still be flexible and not set a precedence. And we use guidelines to help us with our decision making, and those guidelines aren't prescriptive, and so we do have room for movement, and we can do that so long as we are working within legislation. If this process was prescriptive, then there wouldn't be a need for clinicians to be involved and for there to be clinical judgment. And so it's about finding that balance in terms of trying to work with the situations that we're presented with in trying to determine what the best outcome for the client is. I think we really have to recognise and acknowledge that each client needs to be assessed based on their individual circumstances and situations in order to achieve the best outcome for them. And in doing that, I think it's important to recognise that the disability sector is a far more appropriate place for younger people with disability, and that if, in instances where all options have been exhausted and there are no other appropriate places, then the reality is that residential aged care facilities may be the most appropriate place for these clients. It's not about limiting access for younger people with disability, it's about making sure that we're matching the resources that are available at the time that are best suited to meet the needs of the clients.